everyone, my name is Diana Machi and I'm a clinical psychologist by profession. We've partnered with Ponea Health today and we're going to talk about depression for this episode. We'll talk about defining what depression is. We'll talk about the different types of depression, the symptoms of depression, and also the treatment plans for depression. So in this episode, we'll discuss or touch briefly on the 5 different types of depression. I will not call them depression really, but I'll call them mood disorders. So we'll talk about 5 mood disorders. One is major depression. Another one is persistent depressive disorder, what we call PDD or dysthymia. Another one is Bipolar One and Two, which are also major subgroups of mood disorders. Postpartum depression is another one, and the last one we'll talk about in this session is what we call SAD, simply known as seasonal affective disorder. So in major depression or major depressive disorder, this tends to happen, the diagnosis is done by psychologists or psychiatrists after 1 month of one experiencing extreme depressive mood. The second one we talk about is PDD, which is also known as dysthymia. It just means that one is likely to have the depressive symptoms, but less severe over a long period of time. And this dysthymia is normally diagnosed after 2 years of one experiencing the depressive mood. Another one is another type of mood disorder is Bipolar One and Two, which most of the time happens because of the extreme high mood swings. Let's talk about mood swings in terms of high manic episodes or low depressive episodes that one tends to experience. Another one is postpartum depression, which is associated with young mothers, where they tend to experience the depressive episodes, but also have a hard time bonding with their newborns. The last one is seasonal affective disorder. Luckily for us, since we live in the tropics, we're unlikely to experience a seasonal affective disorder, because seasonal affective disorder mostly affects individuals who do not have exposure to sunlight over long periods of time. And with such individuals, it's likely that, or it's noticeable that they experience a dip in the moods. Thank you so much for today's session and for paying attention and listening to me. You can book my services on ponea.com, where we'll get to engage further at a deeper level on the different issues that you may be experiencing. Thank you.